Of course, our duty, first and foremost as doctors, is to provide health service to Nigeria. As an association, we will encourage doctors in Nigeria to provide the best quality service that is available to Nigerians. However, I would say that is under the circumstances we find ourselves. Our hospitals are ill-equipped. We do not have adequate facilities. The doctors are too few. They are overworked. So Nigerians must understand that the conditions under which we work are not perfect. The doctors themselves do not have a safe and secure environment. They do not even have comfortable environments to work in. Our younger doctors, who are the resident doctors and medical officers in many hospitals, do not even have good core rooms to sleep in when they are working. Some of the rooms they stay in are not even fit for domestic animals to stay. And yet you put doctors there and expect them to perform to the best of their ability. Those are the things we will challenge. We will insist that the various hospitals and hospital managements and even the government provide good facilities for us to work with. Help us to ensure that we have more doctors by reducing the brain drain and increasing the numbers that are produced. And then our work environment must be improved, both in terms of our facilities, both in terms of the comfort. For example, you expect a man to remain in the hospital continuously for 3 days, but you make no plan for his feeding. Where he has to sleep is not adequate for him to sleep. Those things must come to an end. And then it's not right to put one doctor on duty continuously every day of the month. Those are things that we will try and strive to put an end to. Once we can achieve all that, then Nigerians can expect that the quality of service that they will get will be much improved. We will also ask the government to put policies in position. And what has happened in the past, I think it happened under Obasanjo's time, the presidential system to improve facilities in hospitals. We're already doing that, but we need it to go faster. So one problem we have is that the budgetary allocation to health is always between 4, maximum 6%. But the Abuja Declaration, and we must note the name, Abuja Declaration, says it should be at least 15%. So why can't we get near that 15%? If we get near that 15%, then we may have adequate facilities. So we will advocate with the government that we should allocate that 15%, which is a declaration made in Nigeria, not 10% of what Nigerians expect. So if we do that, then we can achieve that. So we will continue to advocate for improvement in our health system for the benefit of all Nigerians as part of our responsibility. Of course, as an association, we will carry out activities that represent our corporate social responsibility to our communities around us, and we will help people to the best of our abilities as much as we can. The next question is, how do I ensure that throughout my tenure there will be no strike? There is no way I can assure that. If the government does not do what is required, there will be strike. So I cannot give you that assurance. But what I can do is that I will tell you that we will advocate, we will pursue advocacy first. We will pursue everything that we require to get what is best, both for the doctors, other health workers, and indeed the entire health system for the benefit of Nigerians. And we will call on you and all other Nigerians to join us to ask the government to meet its obligation to the healthcare system of Nigeria. Not just that, and also even our health insurance, to improve our health insurance so that many more people will be captured and will be able to provide universal health coverage to all Nigerians. But we will need your help, the press, the people of this country, to ensure that the government stands up to its responsibilities. But if the government fails to stand up to the responsibility, then we will take any step necessary to ensure that the government meets its obligation to us as individuals, as doctors, and to Nigerians. We will take whatever steps are necessary, even if it involves a strike. But that is not our primary responsibility. Then 3, how do we ensure that brain drain will? Well, there is no way I cannot ensure brain drain will come to an end. It is the government taking the steps which we will advocate for that will bring brain drain to an end.